are back for day 2 and we're so excited about what's been happening in between workshop 1 and workshop 2. We've been out to the community finding out what their priorities are for interventions for suicide prevention. We sent out a survey that was developed by this group here from workshop 1, and it went out and we had over 100 responses. We don't get that kind of response in suicide prevention, so we're quite excited about how that went. We also had lots and lots of feedback on the map that we created within workshop 1, and now we're putting the final touches on that now in workshop 2, ready for the model to be run.
The first workshop was about clarifying the current situation in terms of the roadmap in front of them. So where populations are currently circulating throughout the health system itself. Workshop 2 is about then trying to clarify the interventions which can change the journey that we've been going on historically. So it's about introducing new interventions, thinking about what they may be, whether it's within the PHN, whether it's within the LHD and or others, to try and then give the population more options, more service options, and better quality service options.
I remember when we saw it sort of in action the first time, I was like, oh, this is like a suicide prevention experiment, like sort of virtual experiment. So you can actually see if we put in this intervention and we're able to do it at, get this effect, then what happens if we put in this other one and this other one, and what's going to have the biggest impact in what time frame. So that's been really exciting.
The 2 workshops so far, we've been provided with some information around what system dynamics modelling is and how that can be used to transform the way we plan and then put together our service delivery at a community level. It's great to have all different diverse members of the community and different stakeholders, lived experience, Aboriginal people, the whole diverse cohort of people coming together to inform this process, and I'm excited that that's the way things are now done. So I feel that this process is bringing together the best of data analytics and research and evidence-based literature, as well as our voices, and that's the exciting bit, and bringing it into what we really need.
Just giving a bit of insight to what people are getting after they have a suicide attempt, and what gaps in services or what might be the barriers that they're offering or they're seeing within the community, and for them to actually access care. Especially for a lot of Aboriginal and Torres Strait Islander communities, there seems to be a little bit of there's a gap, and we're trying to link in a more holistic approach with services, more about healing, and with the clinical aspect of what's been delivered. In the past, Aboriginal people are getting told what they need, so it's great to hear from Aboriginal people and communities of what they feel they need. So for me, it's very important to be here to just to give a bit of knowledge that Aboriginal and Torres Strait Islander people are needing some support, and where that's best going to be delivered in the communities.
So I've been doing a lot of work around the PHN dynamic simulation since the last workshop. So we've been out and about talking to a lot of people, largely to have a rural focus and a rural input into what's happening, so that when the PHN are looking at commissioning services, that they can take into account a more rural perspective. We're sort of really going to try and nut out what those services might look like on the ground, so the things that where there are gaps, how we can fill them, and whether that's increased service capacity or new services, and what that actually looks like in a more isolated community versus somewhere like Newcastle, where they've got obviously more services and more access.
For both of these workshops, we've had such a diverse range of people in the room. We've had obviously people from health, but also from housing, from culturally and linguistically diverse communities. Lived experience has been very well represented, and we've also seen some of our Aboriginal colleagues making sure that that Aboriginal voice is heard in this. We'll continue to see and hear from all of these diverse groups into workshop 3.